Um, the distributions of the internal and the external carotid arteries are distributed on the basis of the areas. So first we discuss about the external carotid artery. This is the external carotid artery, which is immediately below the posterior belly of the digastric and the stylohyoid. And this artery is transverse the parotid gland and reaches to the neck of the mandibular here to gives the several branches, and it follows in the four groups like the anterior group, posterior group, middle group, and terminal group. First we talk about the external carotid artery and its anterior group. It's have the superior thyroid artery, lingual artery, and the facial artery. Second is the posterior arteries, which are the occipital artery and the posterior auricular artery. Next is the middle group that consists of the pharyngeal artery, that is the ascending one. And the last is the terminal one, which have the superficial temporal one and the maxillary artery. Now we see from the pictures where are these arteries are located. Uh, this this artery is the superior thyroid artery. This one here, the artery. This one is the superior laryngeal artery. Then there are the arteries of the facial here. Inferior and the lower, inferior lower artery and the lingual branch of the arteries are here. There are the buccal arteries. Mental arteries have various arteries that are communicated with the mental arteries, and the main thing in this is the angular artery. And this one, angular artery, it have the anastomosis with the ophthalmic artery. And the maxillary artery, we discuss in detail about the maxillary artery. Maxillary arteries mainly have three segments. First is the mandibular segment that consists of the inferior alveolar artery, deep auricular artery, middle meningeal artery, and the superior tympanic artery and anterior tympanic artery. Second one segment is the pterygoid segment. It have only two arteries, which was the superior posterior alveolar artery, and there is a muscular branch artery which supply the mascoid muscle and buccinator. Third is the pterygoplatine segment, and it have three arteries. These arteries are important, and these are the infraorbital artery, sphenoplatine artery, descending platine artery. The most important things in these are the following arteries are supply following areas. These arteries are named on the basis of their supplying. Now we discuss about the internal carotid artery, this one, which is segmented, or it have four parts. First is a cervical part. We can from this diagram I couldn't able to show, but in another video I can show it to you. Cervical part, it is the segment that expands from the bifurcation to the external opening of carotid canal. The important thing in the cervical part of the internal carotid artery, it is expanded from the bifurcation to the external opening of the carotid canal. Second segment is the petrous part, and it's around here, and this is occupies the carotid canal, this somewhere here. Carnivorous part is the third one, and it is incorporated into the carnivorous sinus. And last one is the cerebral, which gives the principal branches. Now we discuss about the branches of the internal carotid artery. Its main artery is ophthalmic artery. This diagram is not shown, but it's inside the skull, and it have a following arteries. Mainly it have a main four arteries, that is the ophthalmic artery, and anterior cerebral artery, posterior cerebral artery, and the middle artery, and the last one for the anterior choroidal artery. Now also I am saying that the names are based on their supplies. First of all, we discuss about the internal carotid arteries, and its first part is the ophthalmic artery, and its ophthalmic artery gives several branches, like its distribution, like a central renal artery for the eye. Ophthalmic artery is based on the eye, of course. On the basis of its name, we can decide it. Then there is a posterior and anterior ciliary artery for its ciliary muscles. Next is lacrimal artery for the lacrimal gland. Anterior and the posterior ethmoidal artery for the ethmoids. And its supplies the mucosa of the ethmoid cells and the nasal mucosa. Supraorbital artery, that this is shown in the diagram, this one. Then there is a supratrochlear artery that leaves orbit along the frontal notch. Guys, we know about the frontal notch is situated here, and the main thing is the ophthalmic artery supplies the eyelids and the nose. And the dorsal nasal artery, this one is the anastomosis with the angular artery, with the help of and it's connected to the ophthalmic arteries also, because the superior trochlear artery and the supraorbital arteries are connected, means it's have anastomosis. In this diagram I couldn't able to show you the anterior cerebral artery and middle cerebral artery, posterior cerebral artery, and the anterior choroidal artery, but I discuss some information about these. First of all, anterior cerebral artery, it have a anterior communicating artery. Middle cerebral artery, it runs along the lateral sulcus. It runs along the lateral sulcus, giving the numerous branches. The small branches, it's like all over. It's divided into the capillaries and moreover. Next is the posterior communicating artery from the posterior cerebral artery, which are from the basilar artery, and the last one is the anterior choroidal artery, which runs along the optic tract to reach the lateral sulcus. And it enters to the inferior horn of the lateral sulcus and form the choroidal plexus of the both lateral and third ventricle. Thank you guys for listening me.